Hello everyone.
Hey.
My drug is Montelukast, commonly known as singular. So it's a chewable tablet. It comes in a size about this big, sometimes pink, sometimes it's white. You can also have it in a normal swallowing tablet or in like little granules, so it goes down easier. And the molecular formula is C35H36ClNO3S. The molecular weight is 586 grams per mole. And the name Montelukast comes from Montreal because that's where the company Merck made it. Mont. So why people buy it? It's for asthma and allergies, and it's more for preventative asthma. So say you have like chronic asthma like every day, instead of using your inhaler all the time, it's not to substitute for an inhaler. It's more of you take it every 2 days and you reduce the risk of using an inhaler. And also for allergies, a lot of times it's combined like with sinuses and stuff, or for runny nose, rhinitis. So people have been trying to cure asthma for a very long time. It started with praying to the gods to like repent their sins, in the very early ages. And then they started smoking things in India. They started inhaling incense and smoking things. In China, they drank this tea, which is actually pretty helpful. But the Western culture did not find the tea until the 1800s, even though China had been drinking the tea since like 5000 BC. So more tea. And then in the early 1900s, the doctors in America started prescribing coffee, exercise, and sleep. The basics, be healthy people. I don't know about coffee though. So alternate uses. When Merck and other companies were trying to see what singular could also be used for, they realized that it reduced the inflammation of brains in rats, and they tried testing like the Montelukast on different age groups of rats, some of which one of the groups were younger rats and the other group were older rats who were starting to have mental issues from being old. And they realized that their brains were more inflated, and whenever they gave the Montelukast, they saw that the rat brains were actually were becoming less inflated. So they thought and the rats, like the old rats, actually started showing the vitality of younger rats. So they thought maybe that could help dementia or like Parkinson's disease in humans, but they haven't confirmed it yet. It's just rats right now. So the pharmacokinetics. It's very rapidly absorbed. The mean peak in the concentration is achieved after 3 to 4 hours. And like I said, it's like an anti-inflammatory thing. So like in the bronchoconstriction, it's a bronchoconstriction preventer in your lungs. And like I said, less inflammation. Pharmacodynamics. It is a receptor antagonist, and it's used as an alternative to anti-inflammatory medications for preventive measures. It doesn't inhibit these things, so it's not supposed to be fast acting. That's why we can't use it as a substitute for inhaler. If you're dying, please use an inhaler. And yes, that's kind of repeated again. Next slide. These are the side effects. They all include headache, abdominal pain, dental pain, coughing, dizziness, fever, heartburn, skin rash, congestion, and unusual weakness. And side effects are pretty rare in this medication because it's used throughout the world and under different names. But it's pretty safe to use. A lot of people use it, like even young children. Thank you for watching. This is for Stephanie.